Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, I want to share my experience after about 18 months of using as-needed Clonazepam. I'll start by saying the reason I was prescribed this medication for such a long duration of time is because I do have bipolar disorder, so because of this condition, it kind of takes away a lot of those once-daily medications that many other people can use to try to prevent anxiety. Over this time period, I have had Ativan or Lorazepam, as well as Clonazepam or Klonopin, and I do have a preference for Clonazepam, mainly because it seems to work for a longer duration of time after taking a dose. I found that while using Lorazepam, I may have to take more than one tablet in a day, but with Clonazepam, there hasn't been a time where I've taken more than one tablet in a day, despite the fact that it's prescribed as 0.5 milligrams once in the morning and 2 at bedtime. The main reason I was prescribed this medication is because after having several manic episodes, I really did develop anxiety that would sometimes turn into panic attacks, just over the constant thought of maybe having another manic episode. So I was kind of always on edge, and there would be moments, for example, I may be at work just doing my job, and then the anxiety would start, and then I start to have kind of paranoia that people may look at me and think that I'm acting differently, and then the anxiety kind of cascades into, I guess, what I would call a panic attack, with sweaty palms, potentially a sweaty forehead, and really a rapid heart rate to the point where I'd have to leave where I was doing my work, go to the bathroom, splash water on my face, and kind of try to calm myself down. So the Clonazepam has been very helpful in those moments. It only really takes about 20 to 30 minutes, I personally find, for it to kick in, and then it lasts for about 6 to 8 hours for me personally, and that's more than enough time to get through the rest of the workday and kind of, again, when experiencing anxiety, get back to kind of a safe environment at home. Now, there is a lot of concerns with this medication that if you use it too often, you can develop kind of a substance abuse issue with it, and that is an issue for some people, but that's why I really try my hardest not to use it unless I really do need it, unless that anxiety really gets too intense, too extreme, mainly if it's on the verge of a panic attack. There are other techniques that I may use if I just have mild anxiety, aside from Clonazepam or Klonopin, to try to calm down the anxiety, such as maybe doing a meditation or doing different breathing exercises that you can actually find on YouTube. I find these two methods very helpful to calm down the anxiety. Overall, in terms of side effects, I haven't really experienced any side effects with this medication. If I do take it in the morning, which is very rare, if I wake up with anxiety and I feel like, oh, I don't think I can go to work today, that kind of anxiety, and I do take even maybe half a tablet. Again, these are 0.5 milligrams. I do notice maybe a little bit of drowsiness, but after using the medication for quite some time, as needed, I don't really find that drowsiness really affects me much anymore. Typically in the run of 1 week, I would say the maximum I would use Clonazepam would be 3 times in 1 week. That's really what I try to keep it at that or under that. One thing I will say, if you've watched some of my other videos in the past, I've had substance abuse issues with cannabis in the past, so I'm kind of extra cautious just because I know that I do potentially have kind of that addictive personality. So I really don't want to kind of get into any trouble with this medication. So that's why, again, despite the fact that it is prescribed to me as 1 tablet in the morning, 2 tablets at bedtime, I only use about 1 tablet as needed about 3 times a week. And sometimes I'll go a full week without using it, even maybe 2 weeks without using it. For me, it kind of depends on what time of year we're at in terms of how often I use it. From October to March, when I usually experience depression associated with bipolar disorder, I may use Clonazepam more often because oftentimes anxiety kind of comes with that depression. Now, during the spring months and the summer months, I may not use Clonazepam at all for months at a time because the anxiety is less severe, sometimes non-existent. I should make a note here that if this is a medication that you're looking to be prescribed, there are a lot of physicians, and rightfully so, that are hesitant to prescribe this medication, especially in large quantities, because of what I discussed earlier about the risk of substance abuse with medications like this, with benzodiazepines. I have a really good relationship with my psychiatrist, and he acknowledges the fact that a lot of the main medications for anxiety I can't really use because they have a high risk of pushing me into mania. So for that reason, he's able to prescribe it to me on a monthly basis with a small supply, just to kind of get me through that month. But I should say that sometimes it may be difficult to get this medication. You may have to try other options first before a physician wants to prescribe this to you. And then in that situation, they may only prescribe it in a small quantity. I will say overall, this medication has been a lifesaver for me personally. It's definitely prevented me from missing work on several occasions. It's made me be able to kind of go to social outings when I'm in that kind of phase of depression where the anxiety is lingering over the depression. I don't feel like socializing. This will kind of calm down the anxiety and allow me to kind of go with friends, with groups of family, and kind of just live normally. But again, like I said, I only try to use it at a very low frequency. So I guess to summarize everything that I kind of talked about, I do find this medication very helpful for my anxiety. I prefer it over Lorazepam or Ativan, mainly because I find it works faster. And honestly, personally, I find they both kind of kick in in the same time frame. I do try to use it as less frequently as I can. I try to max it out at 3 times a week. And sometimes I'll use even half a tablet if I don't feel like I need a full tablet. So I don't use it to the maximum extent as it's prescribed, mainly because of my history of substance abuse with cannabis. So I feel like I have to be more responsible with it. But overall, it has been definitely a benefit to me in terms of treating my anxiety and trying to kind of keep my life in a normal pattern, not missing out on things like work or social outings. So overall, it has been a benefit to me in treating my anxiety associated, I guess, with the depression coming from bipolar disorder. So anyway, that's all I want to talk about in this video. I hope this helped you. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. All right, that's it for today. Take care.